Coronary artery disease, most people think of that as being heart disease. And when we talk about coronary artery disease, we're talking about cholesterol plaques that grow just around the arteries of the heart to the point where they eventually can cause blockages. And the very important thing to remember is that everybody on earth has some degree of coronary disease. From about the time that we're 12 years old and on, we start to form little streaks of cholesterol just around the arteries. Coronary artery disease generally becomes a problem when the plaques that are surrounding the artery get so big that they start to block the blood flow through that artery. And really, you can think of arteries as being like pipes. They're just like the pipes in your house. And so if you have this large plaque of cholesterol that's pinching down on the artery and it gets to the point where flow is blocked or compromised, then people start to get symptoms, and this can lead to heart attacks. So when we think about coronary artery disease, we think about different sorts of risk factors. There are risk factors that we call modifiable, and then there's risk factors that are non-modifiable. So what that means is the modifiable risk factors are things that you can do something about. And that would be like smoking cigarettes if you quit smoking, if you have diabetes, getting that under control, getting your high blood pressure under control, getting your high cholesterol under control. Those are all modifiable risk factors. And in fact, that also would include inactivity or not exercising enough. We know that that's a risk factor as well as obesity. So losing weight and doing the things that your doctor tells you about, proper nutrition and et cetera, can help reduce your risk of coronary artery disease becoming a problem. There are other sort of non-modifiable risks, things that you can't do anything about. And that would be if you're a male, 45 years of age or older, or if you're a female, 55 years of age or older. Obviously, you can't do anything about that. And your family history. And the most important aspect of your family history is not necessarily your parents having heart disease, but whether or not you've had a sibling that's had heart disease or heart attacks. So it is very important if your parents have, but if you've had a sibling that's had heart disease, then you're at much higher risk. So it's important to remember that all human beings have some degree of coronary artery disease. And if we don't do something about it, and especially if you have the genetics that predispose you to having problems from coronary disease, if you go out and don't take care of yourself, and if you're inactive and don't eat the proper foods, you could actually cause that coronary artery disease to become much more of a problem much earlier in life than what it really should. And so do all the things that we know we should do. Exercise, eat the right foods, maintain a healthy lifestyle. And hopefully that will help to prevent the coronary artery disease from becoming a problem in your life.